Let me pivot to healthcare. Governor Perry, our governor, you've all heard of him, has an opinion piece in USA Today explaining his opposition to both state insurance exchanges and the federal expansion of Medicaid. He has, as they it's now become the cliche in politics, doubled down on his opposition to federal health reform, despite the fact that we know it's both constitutional and, given the election results, is unlikely to be repealed. Each of you is going to go in and have to deal with a lot of legislation in the House that relates to health care. I'm wondering where each of you feels we ought to be as a state with regard to federal health reform, given the election results and given the likelihood of the Affordable Care Act remaining in place. Mr. Capriglione, I suspect you oppose it.
Right, I
Yes.
do. I do oppose it. I think Governor Rick Perry is exactly right when it comes to this. We as legislators we have fiduciary responsibility to taxpayers. I'm in venture capital, private equity, and the way I look at it is a businessman coming up saying, hey, Giovanni, would you invest in my company? We have this customer that wants us to radically increase our expenses and promises to pay us less and less each time. And when I ask him about that customer, he'll say, well, it's nearing bankruptcy and it's run by a dysfunctional management team. I'm not likely to invest in that scheme. And in that same way, I think it would be wrong of Texas to sign up for this at this time.
Because you think the government is not capable of providing quality or efficient delivery of those services.
The federal government is not, no.
Mr. Capriglione, you know, because I know you pay attention to these things, that we now have 5.8 million uninsured Texans, according to the U.S. Census, 23% of our population, more uninsured citizens as a percentage of our population than any other state. I now know what you're opposed to. Tell me what you're for.
Sure, and I do pay attention to that stuff, and I've looked at the 2010 census, and when you really dig down into those numbers, what you'll see is that, of course, Texas has a more diverse population than other states. In fact, if you net out people here illegally, illegal immigrants who are here, and they're higher uninsured, they're about 62–65% uninsured. If you net that out, that alone gets rid of half the delta between Texas and the national average. If you look at the 7 states that are on that list of the highest uninsured, 6 of them have the highest amount of illegal immigration in there. Texas has a lot of different industries, but our industry mix is such that we have a high agriculture, which has temporary jobs, service, retail, and that sort of thing. What I'm for is that I do think that we can go and make changes in how the government invests. For instance, there's this concept called tax credits, and it's something that I think will come up in the next legislative session. And what it does is allows people to go and invest in low-income, moderate areas using a combination of tax credits as well as private dollars. Myself personally, I've invested with my funds, not with my own money, but I invested funds in clinics in San Antonio and a hospital. And there's a way to be able to go and combine those two things and say, hey, listen, we're going to provide you a lower than standard market rate for this loan or for this investment. Right. But in that process, you're going to have to do a couple of things. And for instance, what I had added in one is said, okay, you have to go and provide a clinic that has a sliding scale. You have to go and have a certain number of students come in each year on a field trip to learn about the eye, and then they'll get a free eye exam after it. So I think there are things that...
These are markets, but these are market solutions.
There are some, yeah, absolutely, market solutions.
And you think the market can adequately provide...
As long as there's a profit to be made, the market will support.
Mr. Bell, what do you think about this question of what the state's obligation should be on health care and its relationship to what's happening in the federal government?
Well, first off, I'm adamantly opposed to whatever you want to call it, Obamacare, which
I think the president's decided that's okay too, so you're not offending him by calling it.
That's right. So, with all due respect to our Supreme Court, it is a very offensive time in history for me to be told that I have to buy a product instead of, which do you buy? Do you buy milk or health insurance? And one you can live without. The other you can't. I know that would be an arguable question, but we do have challenges. I believe the free enterprise system offers us the greatest advantages to being able to deal with those challenges. I think regulation and bureaucracy, to a degree, stand in the way of a functioning system. As far as the governor's stance, the whole process, the way it sets up right now, effectively burdens the state under the pretense that we'll get federal dollars to address the initial portion of that. The further down that road you get, the smaller those dollars get and the bigger that burden becomes.
Right.
And you talked earlier about the public ed demands, $4 to $5 billion. Well, this is a $27 billion conversation.
This is the thing that threatens to eat the entire budget.
It does threaten to eat the entire budget, and so it is certainly something that we've got to take seriously. We've got to address. But I am a believer that the free enterprise system and capitalism
Better way to handle it.
is a much better way to handle it.
Right. Ms. Gonzalez.
So what do we know? We know that Texas nearly ranks last when it comes to insured Texans. We know that Obama won the election. We know that this is going to be implemented whether people are comfortable with it or not. And I think that it's you know, I used to always tell my students, these are people's lives we're messing with. There are people who need access to health care. And so whether we want to implement, whether people feel comfortable, it's going to be implemented, whether we do it or the feds
Right.
come in and do it in 2016, 2018.
Is Mr. Capriglione wrong that the government shows itself often to be unable to provide quality or efficient services, whether it's healthcare or anything else? Is he wrong about that?
I don't necessarily, I mean, I agree with that. I think that the government has proven itself to make the lives of people better if it is really trying to be equitable and fair and really intentionally trying to make people's lives better. So the fact is that we have a healthcare problem. We can either provide people access to healthcare so they have preventable care, so not going to emergency rooms, so that they have insurance, or we can just pay the bill later, and that's going to cost more at the end of the day. But these are people's lives.
So if you had Governor Perry's ear, your message to him would be take the opportunity to expand Medicaid.
Well, these are our tax dollars that are already going to the federal government. In essence, we're saying we don't want our tax money coming back to Texas. That doesn't make any sense.
Right.
It's a political tool, you know, that's used instead of thinking about people's lives.
Right.